Welcome to Calm Mind and Healthy Body, our channel. In today's video, we will delve into the fascinating yet complex world of nervous system disorders, focusing on epilepsy, Alzheimer's disease, and stroke. These neurological conditions can profoundly impact individuals and their loved ones, making understanding their nature and effects crucial. Epilepsy is a neurological disorder characterized by recurrent seizures, which are caused by abnormal electrical activity in the brain. These seizures can vary in intensity and duration, affecting individuals of all ages. Epilepsy can have a significant impact on a person's quality of life, leading to physical injuries, cognitive impairments, and emotional challenges. By shedding light on epilepsy, we aim to raise awareness about this condition and provide support to those living with it. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior. It is the most common form of dementia, with millions of people worldwide living with this condition. Alzheimer's can have a devastating impact on individuals, robbing them of their independence and cognitive abilities. Understanding the complexities of Alzheimer's is crucial in developing effective treatments and support systems for those affected by this disease. A stroke, also known as a cerebrovascular accident, occurs when blood flow to the brain is disrupted, leading to brain damage. Strokes can result in a wide range of physical and cognitive impairments, depending on the area of the brain affected. They are a leading cause of disability and death globally, highlighting the importance of stroke awareness and prevention. By educating ourselves about strokes, we can take proactive steps to reduce our risk factors and improve our overall brain health. By exploring these neurological conditions, we aim to highlight the prevalence and significance of nervous system disorders. Through knowledge and awareness, we can better support individuals living with epilepsy, Alzheimer's, and stroke, ultimately improving their quality of life and well-being. Stay tuned as we delve deeper into each of these disorders in the upcoming segments of this video. Today, we will explore the intricate world of disorders that affect the nervous system, including common conditions like Parkinson's disease and multiple sclerosis. These disorders can profoundly impact brain function and overall well-being, making understanding their nature and potential treatments essential. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Parkinson's disease is a neurodegenerative disorder that primarily affects movement, causing tremors, stiffness, and difficulty with balance and coordination. It is characterized by the loss of dopamine-producing neurons in the brain, leading to disruptions in the body's motor control. In addition to motor symptoms, Parkinson's can also result in non-motor symptoms such as cognitive impairment and mood changes. While there is currently no cure for Parkinson's, treatments such as medication, physical therapy, and deep brain stimulation can help manage symptoms and improve the quality of life for individuals living with this condition. Multiple sclerosis, MS, is an autoimmune disorder that affects the central nervous system, leading to inflammation and damage to the protective myelin sheath surrounding nerve fibers. This damage disrupts the communication between the brain and the rest of the body, resulting in a wide range of symptoms such as fatigue, muscle weakness, and vision problems. MS is a highly variable condition, with symptoms and progression differing among individuals. Treatment for MS focuses on managing symptoms, slowing disease progression, and improving quality of life through medications, physical therapy, and lifestyle modifications. By understanding the impact of disorders like Parkinson's disease and multiple sclerosis on the brain and nervous system functions, we can better appreciate the challenges faced by individuals living with these conditions. Recognizing the symptoms and potential treatments for different nervous system disorders is crucial in supporting and caring for those affected. In the next segment of this video, we will delve deeper into specific symptoms and management strategies for these and other neurological disorders. Stay tuned for more valuable insights and information. This segment will delve into the intricate world of epilepsy, exploring its causes, symptoms, and management strategies. Understanding the neurological basis of epilepsy and how seizures occur is crucial in effectively managing this condition and improving the quality of life for individuals living with it. Seizures in epilepsy occur when there is a sudden surge of electrical activity in the brain, leading to disruptions in normal brain function. This abnormal activity can manifest in various ways, resulting in different seizures. These seizures can range from focal seizures, which affect specific areas of the brain and may cause altered consciousness or unusual sensations, to generalized seizures, which involve both hemispheres of the brain and can lead to loss of consciousness and convulsions. The impact of seizures on individuals can vary, affecting their physical, cognitive, and emotional well-being. Managing epilepsy involves a combination of treatment options and lifestyle modifications aimed at reducing the frequency and severity of seizures. Medications, such as anti-epileptic drugs, are commonly prescribed to help control seizures and prevent their recurrence. In cases where medications are ineffective, other treatment options, including surgery, vagus nerve stimulation, and the ketogenic diet, may be considered. Lifestyle modifications, such as getting adequate sleep, managing stress, and avoiding triggers, can also play a significant role in managing epilepsy and improving overall well-being. By shedding light on the causes, symptoms, and management of epilepsy, we aim to empower individuals living with this condition and their caregivers with valuable information and resources. Stay tuned for more insights on epilepsy and other neurological disorders in the upcoming segments of this video. In this section, we will unravel the complexities of Alzheimer's disease, examining its characteristics, progression, and impact on individuals. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior. Understanding the hallmark symptoms of Alzheimer's and its effects on memory and cognition is essential in recognizing and managing this debilitating condition. The hallmark symptoms of Alzheimer's disease include memory loss, confusion, difficulty with language and communication, and changes in mood and behavior. These symptoms can vary in severity and progression, impacting an individual's ability to perform daily tasks and maintain independence. As Alzheimer's advances, it can lead to significant cognitive decline, affecting not only memory but also judgment, reasoning, and decision-making skills. Alzheimer's disease progresses through several stages, starting with mild cognitive impairment and advancing to moderate and severe stages of dementia. In the early stages, individuals may experience subtle memory lapses and difficulty with concentration, while in the later stages, they may require assistance with basic activities of daily living. The progression of Alzheimer's can vary among individuals, with some experiencing a more rapid decline in cognitive function than others. Current research on Alzheimer's disease is focused on understanding its underlying mechanisms and developing potential treatments to slow disease progression and improve symptoms. While there is currently no cure for Alzheimer's, medications such as cholinesterase inhibitors and memantine are commonly prescribed to help manage symptoms and improve cognitive function. Other approaches, including lifestyle modifications, mental stimulation, and support services, can also significantly enhance the quality of life for individuals living with Alzheimer's. By shedding light on the characteristics, progression, and impact of Alzheimer's disease, we aim to raise awareness and provide valuable insights into this challenging condition. Stay tuned for more information on Alzheimer's research, treatments, and support resources in the upcoming segments of this video. In this segment, we will embark on the journey of surviving a stroke, exploring its causes, types, and the road to recovery through rehabilitation. A stroke occurs when blood flow to the brain is disrupted, leading to brain damage and potentially life-threatening consequences. Understanding the critical differences between ischemic and hemorrhagic strokes is crucial in recognizing the signs and symptoms of a stroke and seeking immediate medical intervention. Ischemic strokes are the most common type of stroke, accounting for approximately 87% of all cases. They occur when a blood clot blocks a blood vessel in the brain, cutting off the blood supply to a specific area. Hemorrhagic strokes, on the other hand, occur when a weakened blood vessel ruptures, causing bleeding into the brain. Both types of strokes can result in significant brain damage and neurological deficits if not promptly treated. Immediate medical intervention during a stroke is critical in minimizing brain damage and improving outcomes. The acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, helps recognize the signs of a stroke and act quickly to seek medical help. Time is of the essence during a stroke, as timely administration of clot-busting medications or surgical interventions can help restore blood flow to the brain and prevent further damage. Post-stroke rehabilitation plays a vital role in recovery, helping individuals regain lost abilities and improve their quality of life. Rehabilitation strategies may include physical therapy to improve mobility and strength, occupational therapy to enhance daily living skills, speech therapy to address communication difficulties, and cognitive therapy to address memory and thinking challenges. The outcomes of post-stroke rehabilitation can vary depending on the severity of the stroke and individual factors. Still, with dedication and support, many stroke survivors can make significant progress in their recovery journey. By shedding light on the causes, types, and rehabilitation after a stroke, we aim to empower individuals and their caregivers with valuable information and resources for navigating the road to recovery. Stay tuned for more insights on stroke prevention, management, and support services in the upcoming segments of this video. Epilepsy, a neurological disorder characterized by recurrent seizures, can have a significant impact on individuals' quality of life. Understanding the neurological basis of epilepsy, different types of seizures, and treatment options is crucial in providing support and care to those living with this condition. We encourage viewers who may be affected by epilepsy, Alzheimer's, or stroke to seek further information and support from healthcare professionals, support groups, and advocacy organizations. By staying informed and connected, individuals and their loved ones can better manage these neurological conditions and improve their overall well-being. We invite viewers to like, share, and subscribe to our channel for more educational content on neurological disorders, health, and wellness. Together, let's continue to raise awareness, promote understanding, and support those living with disorders of the nervous system. Thank you for joining us on this enlightening journey.